So if you're not pregnant, or if you are a man, or if you're not having a baby, you can skip this video. Hi guys, it's me, Belle, and today we are with Dr. Zara Chan. She's my OB-GYN. She's very experienced and she has 3 kids. So today we're going to be talking about the unglamorous side of pregnancy. I know that I have a lot of questions for you, but we're going to narrow it down to a few topics. So I guess, I'm in my 3rd trimester, and when you're in your 3rd trimester, there are a bit more complications or things that happen, changes in your body that we don't necessarily talk about. Yeah. So today we're going to talk about that and cover these topics.
Okay, all the things that people don't want to mention, right?
Exactly. All the things that happen, and then you see it on chat groups and it's like, is it normal? Because people don't necessarily talk about it.
Yeah.
What I wanted to start with was hemorrhoids.
Okay.
So, can you talk to us about hemorrhoids and what is a hemorrhoid? Why is that a thing that pregnant women should know about?
Okay, just starting down south.
Yeah.
So hemorrhoids are very common in pregnancy. In fact, there are so many things in pregnancy that are uncomfortable, not glamorous.
Yes.
They don't contribute to the mommy's glow sensation.
Yeah.
And yet they happen all the time. So hemorrhoids is one of them. Now hemorrhoids come from your bum.
Okay.
They're from the anus, and it is when some of the blood vessels there on the inside of it come out. So we say they prolapse out.
So it's a blood vessel that comes out.
Yeah.
There's no shot here of any hemorrhoids. Okay.
No views of that. But it's when the blood vessels come out. And the reason hemorrhoids happen is because during pregnancy, all of the hormones make all of those muscles and the tissues just a little bit weaker, so it's easier for it to come out. The other main reason is because of just the weight of the baby. So a lot of moms in the 1st and also 2nd trimester won't really get hemorrhoids. It's when they get to the 3rd trimester.
Okay, so now.
Yeah, right now. And when the baby's getting heavier, it's putting all of that pressure down into the pelvis and everything down there, including the rectum. And all of that pressure is what causes the hemorrhoids.
Is there a way you can avoid hemorrhoids, or is it just like something that comes with pregnancy?
We do say that there are some things that you can do. So for example, avoiding constipation. Now that, again, is another thing.
Avoiding constipation. Okay.
That's another thing in pregnancy that is very common. It's unpleasant. And
it's very real.
And it's very real. And, for some people, the constipation is so bad that they get abdominal pain.
Yeah.
We have to differentiate. Is this pain related to, the baby and the pregnancy, or is it because of constipation?
Yeah.
But constipation, you're sitting on the toilet, you're bearing down and waiting for it to come out, and that pressure is also going to contribute to hemorrhoids.
Why do pregnant women, why are they more prone to constipation?
So it's because of the hormones.
So everything leads back to hormones.
Yeah, so the hormones slow down how your bowel is moving, and then afterwards, so it just makes you more constipated. The other thing is the reasons for constipation will change in the 1st, trimester of pregnancy versus the last trimester. So in the 1st trimester of pregnancy, a lot of people have a lot of nausea and vomiting. They can't eat, they can't drink.
That's from the hormones again.
Yeah.
And so it switches.
And then it leads to dehydration. And so all that dehydration then also contributes to the constipation. So in order to address the constipation, we often say, drink more fluids, eat enough fiber. Yeah. And also, if you can, and it's safe, to stay mobile, because stay active. That definitely helps.
Yeah.
I think in terms of hemorrhoids, another thing that people are often very keen for vaginal delivery, and we often never mention because we don't want to turn people off of vaginal delivery, is that the actual pushing itself can also lead to hemorrhoids.
Got it.
Because you're pushing a lot down into the vaginal area, down into the buttock area, and all of that. If
then it can come out.
Yeah, even if you had a little hemorrhoid that didn't come out, then at the end of the delivery, it usually would have come out.
Okay.
And then after the pregnancy, then you just kind of have to wait for it to go back in.
All right, that was a great introduction. Hemorrhoids, constipation, and you also tackled hormones. I guess I wanted to take a deeper dive into hormones. A lot of people know that when you do get pregnant, you do have an increase of surge of hormones, and that's because you're producing the baby, correct? Now let's talk about your libido. Women who are pregnant, this is no secret, tend to be hornier or have more of a sex drive.
Yeah.
Why is that? And what about, can we talk a little bit or more about sex during pregnancy while a woman is pregnant? Is it safe? Is it not safe?
Yeah.
Does it depend on the pregnancy?
Okay, so first off,
Asking for
I
a friend.
guess. Okay. Nobody's ever asked me, why do I feel hornier? But yet they do.
Yeah.
And again, you said so yourself, it's actually because of the hormones. So, there's a huge surge in the estrogen, there's a huge surge in the progesterone, but also a huge surge in the testosterone. So what some women don't know is that, even women have testosterone, and that will be accountable for the sex drive. And
Does it depend if you have a boy or a girl?
No.
Okay.
No. And so all of that will contribute to everybody just getting hornier after becoming pregnant. Contraception is not an issue in this case anymore. But yeah, so in terms of having sex during pregnancy, as long as the pregnancy is, carrying on fine, there's no bleeding, usually having sex is okay.
Okay.
There are certain circumstances where we might say don't have sex. So very specifically, for example, if a woman's placenta, so the placenta is the organ that provides the baby with nutrients. If the baby's placenta is very low, okay, it's covering the opening of the cervix, so that's where the baby comes out from, then we say, no to sex.
Okay.
Because sex can trigger bleeding.
If the placenta is low.
Yeah.
Got it. Okay.
For some people, they have a very short cervix, okay, and we're afraid that the baby might come early, so preterm, then that's also a no to sex.
Okay.
Otherwise, if everything is fine, we say it's good to have sex during pregnancy. Towards the end of pregnancy, now third trimester is quite tricky to have sex because your belly's so big, and some women just feel so heavy, and also I guess it's also the sensation. A lot of women, some women I would say just don't feel as sexy when they are in that third trimester.
Yeah.
But
the level of libido and the horniness is still there, right?
it's still there. Actually,
I'm just asking for a friend.
Once you get to term, and if people are planning for a vaginal delivery and we want that vaginal delivery to happen earlier rather than later, we encourage it.
Okay.
We say go for walks, have sex again, and bounce on a fit ball.
Okay, that's a natural way to kind of induce labor.
Yeah. Sperm has some qualities in it that can help soften the cervix, so it does help the vaginal delivery.
So sex is definitely something that is okay and safe.
Yeah.
As long as you don't have what you mentioned, which
Some
is the
specific
placenta.
indications.
Yeah, low.
Yeah.
Okay, that's good. What about sex toys like vibrators?
So as long as it's your own sex toy.
I'm not borrowing. Okay.
So as long as it's your own sex toy, it's usually okay.
Okay, wait, what do you mean it's your own? Like it's clean and whatever?
Yeah, really it's mainly an issue about hygiene. We don't want any infections.
Of course.
So sometimes shared sex toys do lead to a bit more vaginal infection.
I understand. Shared sex toys.
Yeah,
okay.
so shared sex toys do lead to a bit more vaginal infections. And
you won't be like
don't want
borrowing that from a friend or something.
Yeah, so if you were to go for sex toys, it's just your own better.
Okay, noted.
Yeah.